Hello, and welcome to another episode of Healthy Mind, Body, and Spirit. We're in season 4, and I have an amazing guest today who is going to introduce herself. And welcome to Healthy Mind, Body, and Spirit, Dr. Tailor.
Well, thank you so much for having me, Dr. Rondo. I'm so excited to be here today.
Yes. Tell us about yourself and
Sure.
How did you get into the field of medicine?
Great question. So my parents immigrated here from India back in the 1979.
Okay.
And so they moved to Kentucky to be close to where my grandparents were, which was Tennessee. And of course, being immigrant families, you push your kid to be a doctor, lawyer, or engineer.
That's
and
what I've heard. Okay,
yes,
okay.
and you just so happened that I fell in love with being a doctor. So I originally wanted to be a cardiologist, and unfortunately lost my grandmother my senior year of high school because she had had a heart bypass surgery. And she had some complications following. So seeing that, it kind of made me think, I don't know if I actually want to do this. And
So you had an up close and really personal.
very much so,
Yeah,
very
yeah.
much so. So that caused me to take a step back. And my grandfather, my grandfather and my grandmother had been together for 50 years. So when she passed away, it was very hard on him. And he was going through his own mental health issues with her passing. And so helping him with that journey really inspired me to get back into thinking about medicine as a career field. And so I did end up applying for medical school, went to the University of Louisville for med school, stayed here. I know, got to get our L's up.
Right. Always do it wrong. but yeah.
You don't want to do it the wrong way.
Right.
But ended up finding medicine as my calling that way. Graduated from U of L, went on to do internal medicine with U of L as well. Stayed on there as a chief resident and faculty for 2 years, and then found this current position where I'm at Norton Healthcare, where I'm providing primary care to patients, which has really been rewarding.
Wow. So you started out, you had a very personal,
Yes.
perspective from the field of medicine with your grandmother.
Yes.
So it actually ended up working out with the either doctor or medicine, engineering or law. So that worked out. Yeah.
It worked out. It still fell into those pieces, but at the same time, I knew what it was like to be on the other side of being the patient and the patient's family.
Yeah. So you could truly relate.
Yes.
So you are, in particular, there's some very special things about you, and that's some of the things we're going to talk about.
Sure.
You have experienced some firsts. So can you tell us about your first with both the Greater Louisville Medical Society and then the Kentucky Medical Association?
Sure. So actually, when I was in medical school, I got very engaged with the Kentucky Medical Association and the Greater Louisville Medical Society, and I attribute a lot of that to the fact that I was a political science major in college. And I started to see this interplay of how government was influencing healthcare. And I remember mentioning that on an interview, and the interviewer was not happy with me because he clearly had other ideas. And
So
of
there
course,
should be a huge separation.
there should be a huge
Yeah,
separation
yeah.
in his mind. And I was thinking, no, like for healthcare to continue, there's going to have to be more involvement in both of these spaces that overlap. And of course, we see that in, 2010, when the Affordable Care Act gets passed.
Yes.
So with that background, I was like, I want to find a way that we can continue to advocate for important issues on the government side, as well as still being part of medicine. And so that's how I found the Kentucky Medical Association, the Greater Louisville Medical Society. And so I've been a member actually since I started medical school. So that was 2006.
Wow. Okay.
So this is now my 16th year of involvement with both organizations.
You're an absolute pro. My goodness.
Or a huge nerd is what you mean. So it just gave me an opportunity.
That too.
So it
That's
gave
okay.
me an opportunity to learn more about medicine, but then also use my background in political science to how do we advocate for this with legislators who spend half their time working their day jobs and then the other half of their time going to Frankfurt and trying to lobby for improved health for all Kentuckians. So how do we give them background so that way they have a better awareness of this?
Wow. So you've just been able to really bring together two things that you really enjoy. It sounds
Correct.
like advocacy in the field of medicine.
Correct.
Wow, we have needed you for many years. So
I'm
yes.
trying.
Yes.
I'm trying the best as I can.
Yes.
So through the Greater Louisville Medical Society, and I'm sure you all remember when I was president, since I think I was on TV and interviews a lot talking about COVID.
Yes.
It was just this being engaged, being willing to be an advocate, that I ended up working up the ranks and became the first Indian female to be president of our local medical society in 2020. I think I was also one of the youngest,
Yes.
which was a little surreal as well. But it just happened to work out, and obviously through 2020 we had to have so much advocacy. I know you did a lot of advocacy as well, to just educate the public, educate the legislators. This is why we need to take these precautions and stay safe. And so that was 2020.
Ooh, a lot happened
A
during 2020.
lot happened during
Yeah.
2020. And so from there, I became the next president of the Kentucky Medical Association, which I was honored to get inducted in August of 2022. So I'm currently now the first female of color, also the youngest.
Wow.
I'm the first female from Louisville.
Really?
What? I know. I didn't realize this either.
So KMA has been in existence for how long now?
I believe it's 172 years, and we've only had 4 females.
And you're the first one of color.
Yes.
Wow.
I know, right?
Wow. So come on, Kentucky.
We
yeah,
gotta.
Yeah.
Yeah.
Okay. Wow.
Yeah.
Okay.
So maybe I'm looking at a future.
Absolutely not for me. Absolutely not.
I had
but
to
yeah,
try.
yeah.
I had to try.
Indiana. Yeah. But
Okay.
yeah. I actually do a lot in Indiana.
I figured you did a little
I
bit
do
of both.
Yeah, I do both. So yeah. But you're absolutely right. Advocacy is so,
It's so
vitally
important.
important.
It's so important.
For our world. And so speaking of which, the whole advocacy component, particularly for our community, we pretty much
Yeah.
are, focused on improving the African American community locally.
Definitely.
So, in what ways can or has Kentucky Medical Association and also the Greater Louisville Medical Society kind of been able to help with the health disparities, or what kinds of things are you all going to do?
I know when I was president for Greater Louisville Medical Society, we did a series of videos that were CME on equity and recognizing some of the implicit biases that we have. How do we address those for ourselves, and what do we need to look for as we're taking care of a patient?
So when you say
so-
CMEs, for
continuing medical education.
So that's
So-
for us as physicians.
Yes.
Okay.
Because
okay.
I think we also need that better awareness.
Absolutely.
Because how can you know, I know my experience, you know your experience, another physician may say they know their experience, but how can we understand someone else's shoes if we've never even been able to place ourselves in those shoes?
Right. And being culturally, what we call, I guess, culturally competent, or
Correct.
someone actually corrected me the other day. It's not
Oh.
necessarily culturally competent, but culturally, because you
Sensitive?
can't, culturally sensitive or
Yes.
culturally curious.
Correct.
In terms of like looking at another culture and really being able
Yes.
to take care
Exactly.
of them. So
Exactly.
yeah.
So that was the hope with the CME. So it became an enduring CME event that folks could go back to when they wanted a refresher,
Okay.
and help them get better awareness
Okay,
of
okay.
what being culturally sensitive is. From the Kentucky Medical Association standpoint, I know at our annual meeting, we talked some about social determinants of health.
Yes.
Because that has been such an important factor. And I mean, we can just look at our city here, right? Like
where
could
we are right
where we
now.
are.
Yes. Yes.
And compared this to a zip code east of here, and I think we have a 12-year age discrepancy in
Yes.
terms of life
Life
expectancy.
expectancy, yes.
And
That's huge.
It's huge.
Yeah.
And it always shocks me that when you share that tidbit, people do not realize, you know? And there's so many factors that go into it. And I think that's where we need our continued education of social determinants of health. Like, do we have healthy sources of food? Do we know, like, do we have heat? Do we have water? Do we have transportation?
Yes.
Childcare?
Yes.
Like, is your home safe to be living in?
Yes, yes.
I think all those factors are things that as physicians we need to be more aware of.
And we just kind of assume
We
those
totally
things.
assume.
Like, we'll tell someone, okay, you need to eat better, you need to exercise, but if they're living in a food desert that is not safe, where they don't feel comfortable even walking outside,
Correct.
how can they?
How can you?
Yeah.
I had this conversation with a lady recently who, she's unfortunately been couch surfing for the last year and a half. She lost her housing because something happened to the building. She's been living with a family member, but she doesn't always feel comfortable. So sometimes she's in her car, sometimes she's at someone else's home.
Wow.
And we were talking about her diabetes, which with everything else she'd forgotten that she had. And I was like, well, she's thinking about, well, I want to lose weight. I want to get my sugar under control. I'm like, we need to get you a place to live first.
Right, right.
Because right now, even if we get you fresh food and all these good, where are you going to put it?
Yes,
And that's so important. And I think I'm seeing it in the younger generation of physicians. They're recognizing this. They're learning more about it in medical school. So I think we are going to have physicians with a broader world view.
Yes.
But I'm hoping we can take the current physicians as well and get them up
Educate
to
us.
speed.
Yes. So improving the pipeline, that's one thing that
Yes.
is vitally important, I believe, to help with the health and the wellness of our community. What is
Definitely.
KMA or
GLMS.
GLMS, sorry.
You went
could
to
say
the
that.
old name, it's
right,
okay.
Right. Doing to help improve the pipeline, particularly in the African American community, because we have so few. I think our population, in terms of the city of Louisville, I think is about 13% African American, but we only make up maybe, I think it's 3 or 4% of the physicians.
Right.
So maybe even less than that. So
Right.
how do we? What can we do, and what in terms of improving that pipeline?
Right. And I think there's so many ideas that I've heard floating around regarding this. And I know Fall City Medical Society
Yes.
also does an incredible job of just trying to be out in the community and pairing with medical students while they are at the University of Louisville.
Yes,
But
and not only medical students. The Fall City Medical Society just is the African American, component
Yes.
of the American Medical Association.
National Medical Association.
I'm sorry, National Medical Association.
Yes.
Thank you for.
No problem.
But National Medical Association was founded because African Americans could not join the AMA, or the American Medical Association.
Yeah.
So Fall City is just that local component
Correct.
of that. And member, and it's huge in terms of just, the whole pipeline
Right.
and potential, not just starting in medical school, but starting at a much younger age, just getting
Correct.
children interested in the field. So.
And I think we're trying to make strides there. And I think pairing with Fall City, some of the members of Fall City sit on our board. So it's been a great
Yes,
way of
yes.
having an idea of what's going on, but improving that partnership and improving opportunities for mentorship with our undergraduates, because we have so many universities here. I know we've referenced U of L. I know we have Simmons and Bellarmine and Spalding. There's all these opportunities, but it's how do you best capture that generation? I think we're all struggling with that.
Yeah.
But
And I think that the
we
pandemic-
did
Yeah.
impact that, because even the partnerships that we had with the medical students, we haven't been able to do those in the same way, given trying to stay safe.
Absolutely. So it does make it a little bit more difficult.
It does.
Just overall.
But definitely one of those areas where we need to make a bigger impact. So I hope we can continue to strive for improving mentorship and just also seeing like women in STEM, women in medicine, because I think you need to
Yeah.
see that when all you see are men in medicine.
Yes, yes, yes. But I think that is changing. That I think the tide is changing just overall. And yeah, I was telling someone I never really saw female physicians
Right.
growing up, and
Right.
so it's hard to kind of be what you can't see. But I know I went to Spelman College in Atlanta, and I saw
Yes.
lots. So
That's
yeah,
helpful.
but we'd like to really have that
We
here.
really need
Yeah.
to do a better job on that. So I'm hoping and striving that we can do better in that field.
Yes, yes. You're already doing a great job. So yes, yes.
Trying.
Just your being who you are
Well,
is
I appreciate
is great. So we also want to talk about a little bit of physician-led care
Yes.
and what that looks like and what, I remember just recently you wrote an
Yeah.
article in the Courier. So can you kind of expound on that?
Yes. So we've got a lot of members of the healthcare team. We've got our nurses, our nurse practitioners, our physician assistants, our respiratory therapists, our residents, our medical students. And
It's a lot of people
it's
coming
a lot
into
of
some
people,
of those rooms. Yeah,
especially
yeah.
if you're in the hospital. I mean, my small team at my clinic is my medical assistant, my LPN. Like, I need this team to be and I shouldn't forget our pharmacist.
Yes. Oh, yes. Yes.
Yes. So we need this team around us to take the best possible care of the patient, but also to make sure they have the best information
Yes,
as well.
yes.
So that's really what inspired the physician-led team, and particularly in our rural areas. And I know our urban areas, we have many spaces that are underserved here as well. And in both of those spaces, we need to make sure that patients are getting the best care possible.
Yes.
Because when we look at our stats as a state, we're one of the unhealthiest states in the
Yeah.
country.
Yeah.
I think we're second for adult obesity, number one for childhood
Wow.
obesity.
Wow.
So,
Kentucky as a state is #1 in childhood obesity?
yes,
Whew, okay.
we've got a lot of work to do.
We've got a lot of work. But that flies in the face of, okay, we're a basketball state and we're also into horse racing. I mean, horses.
I know, right?
So, okay, all right. Well, we have some work to do.
We have
Yeah,
some work
yeah.
to do. So I think having that physician-led team makes sure that our patients are getting the best quality of care
Okay.
and then the best outcomes, because we need that as much as possible to help improve the health of our population.
Okay, okay,
So-
absolutely. Because the physicians are being the leaders in terms
Correct.
of, also knowledge,
Correct.
training, the number of hours. So all of that, that doesn't negate, the role that others can play.
Definitely.
But yeah, you definitely want your team to be led by a physician.
Correct. And I think especially in our rural spaces, we have to make sure that we have all of those voices to get the patient the best possible care that they could have.
Absolutely, absolutely. How do you envision the future of medicine, particularly maybe just for your practice and for the state of Kentucky
Ooh.
as president of Kentucky Medical Association?
That's a hard question. I think we have a lot of hurdles right now. There's just talking about how unhealthy we are as a state. We have a lot of things that we need to strive to improve. And then obviously that starts with us as the physicians. It starts with programs like yours that are helping educate the community. We have to do better. And a big part of all of this has been health misinformation. You and I could probably have another
Oh my goodness.
hour-long conversation
Yes.
about what that has done to our population and how that's impacted them. So I think the more knowledge we can give ourselves as physicians, so that way we can take the best care of our patients, but also more of the knowledge that we can give to our patients themselves.
Yes, yes.
So they feel more empowered. So that way when they read something up on Google and they pull that blog and they pull this other piece of information, they can be astute enough to realize, hey, this might not be accurate information. Let me ask my healthcare team about
Yes,
this.
yes. And that's you just hit it right on the nail, just having that relationship
Correct.
with their healthcare team, whether it's their physician or their nurse practitioner or
Correct.
physician's assistant.
Correct. Whoever that
someone-
member of the team is, someone who can give them accurate information and
Right.
either confirm or give them correct information if they're reading something incorrectly.
Or watching TikTok, or
There's so
Facebook.
much on TikTok.
Yeah, there is a
There's
lot
so
on
much on
yeah.
TikTok. So I
And not a lot of doctors are on TikTok.
No,
so yeah, I think
no.
yeah.
So that's what I foresee as our next hurdle. But I think we can get there if we're all working together. And again, being a team. Because we need our nurse practitioners. We need our physician assistants. We need our pharmacists. How can we best work together to make sure our patients are getting the best care?
Best
because in the
care.
end, that's what it comes down to. And I think for any health system or any physician in this state, it all comes back to what can we do for the patient?
For the patients, yeah, they
Yeah.
are central to the health overall. Okay, well, one last question.
Yes.
As the new Kentucky Medical Association president and first youngest, and then also the first female of color
Yes.
to hold that role, how do you take care of yourself?
Oh, such a great question. Thank you for including this. I try to make sure I'm sleeping enough.
Okay,
Because sleep is
what,
so
i- what is
important.
enough? What is enough, Dr.
I'm shooting
Taylor?
for at least 7 to 8 hours.
Okay, okay.
And trying to make sure I'm sleeping soundly through the night.
Okay, not up after 2 hours and yeah,
Correct.
okay,
Correct,
okay.
because that could indicate something else is going on. But I also want to make sure I'm getting enough sleep. So that's one thing that I've built into my schedule. I've been
Good.
utilizing meditation as well,
okay.
especially something to help me relax before I'm about to go to sleep.
Okay.
And trying to utilize it more during the day. It's a practice of meditation just as it is a practice of medicine. And then I've been working out, so I've been doing Peloton workouts,
Wow,
which are
okay.
digital. We've got
Yes,
some
yes.
yoga on there. We've got some running and walking. So trying to do that when the weather permits. Today is not a good day for that. And then I also enjoy Bar 3, which is a yoga, Pilates, and ballet combination.
And it's called Bar 3? Okay, we'll
so I
have
enjoy
to have
that.
yeah.
I will let you know.
Yes, yes.
So-
That is, you're just expanding my mind too. So, okay, awesome. So, getting enough sleep,
Yes.
getting your physical activity,
Yes.
and meditating.
Yes.
That sounds like those are key. And then something new, which is the Bar 3.
Bar 3.
Okay,
Yes.
Bar 3. Okay, I see.
So
Okay.
that's what I do to keep myself healthy.
Awesome.
So I'll let you know at the end of the winter season how successful I've been.
Awesome, awesome. Great information. So, thank you so much for joining us on
No problem.
this episode of Healthy Mind, Body, and Spirit. You have really given us a lot of good, great tips, great information on helping locally
Yeah.
our community to thrive as much as we possibly can. So thank you so much for coming.
Thank you for having me.
Yes. And thank you for joining us for another episode of Healthy Mind, Body, and Spirit. Have a great day.